Assalamu alaikum students. Our topic of today is Child Survival Index and Congenital Malformations. The basic measure of infant and child survival is under 5 mortality rate. It is defined as the number of deaths under the age of 5 years per 1000 live births. A child survival rate per 1000 births can be simply calculated by subtracting the under 5 mortality rate from 1000. Dividing this figure by 10 shows the percentage of those who survive to the age of 5 years. Child Survival Index determines the need for preventive services through breastfeeding, adequate nutrition, safe water, immunization, oral rehydration therapy, and birth spacing. Our next topic is congenital anomalies or congenital malformations. Congenital disorders are defined as those diseases that are determined before or during birth and which are recognizable in early life. Congenital malformations include not only anatomical defects but also molecular and cellular abnormalities present at birth. Congenital malformations should be confined to structural defects at birth, and the term congenital anomaly is being used to include all biochemical, structural, and functional disorders present at birth. Congenital anomalies affect an estimated 1 in 33 infants and result in approximately 3.2 million birth defect related disabilities every year. An estimated 270,000 newborns die during first 28 days of life every year from congenital anomalies. Congenital anomalies may result in long-term disability, which may have significant impact on individuals, families, healthcare system, and societies. The most common serious congenital disorders are heart defects, neural tube defects, and Down syndrome. Congenital anomalies may be genetic, infectious, or environmental in origin. Most often it is difficult to identify the exact causes. Congenital anomalies can be prevented through vaccination, adequate intake of folic acid and iodine, and antenatal care. Causes and risk factors include genetic or chromosomal, environmental, socioeconomic status, infections, and nutritional status of mother. The congenital disorders with genetic etiology are chromosomal abnormalities in which chromosome is either missing or in excess. Examples include Down syndrome, Klinefelter syndrome, and Turner syndrome. Inborn errors of metabolism include phenylketonuria and galactosemia. Other causes include single gene defects such as thalassemia, sickle cell anemia, and sex-linked disorders, for example, hemophilia. Others include congenital dislocation of hip, clubfoot, and neural tube defects. Environmental factors include intrauterine infections, for example, rubella, cytomegalovirus, toxoplasmosis, syphilis, drugs, for example, thalidomide, stilbestrol, anticonvulsants, tobacco, high dose of vitamin A during early pregnancy, alcohol, anesthetics, etc. Maternal diseases complicated by pregnancy, for example, diabetes, cardiac failure, irradiation, and dietary factors, for example, folic acid deficiency. It is estimated that about 94% of severe birth defects occur in middle and low resource countries. Advanced maternal age also increases the risk of some chromosomal abnormalities, including Down syndrome. Maternal nutritional status, which leads to congenital malformations, include iodine deficiency, folate insufficiency, obesity, and diabetes mellitus. Maternal infections include torch infections which we have already discussed, varicella and HIV. If a pregnant lady contracts rubella during her pregnancy, the baby can have malformation of the eye, cataract, microphthalmia, malformation of the ear, congenital deafness, malformation of heart, such as patent ductus arteriosus, atrial septal defects, ventricular septal defects. Cytomegalovirus can cause cerebral calcifications, blindness due to chorioretinitis, cognitive hepatosplenomegaly. Chickenpox in pregnancy has 20% incidence following infection in first trimester, and it can cause limb hypoplasia, mental retardation, muscular atrophy. HIV/AIDS can cause microcephaly, growth retardation, and abnormal facies. Radiation is another important cause of congenital malformation. Studies of offspring of Japanese women who were pregnant at the time of atomic bomb explosions over Hiroshima and Nagasaki, who survived the blast, have reported to have 28% abortions, 25% gave birth to children who did not survive their first year, 25% of the surviving children had abnormalities of CNS, for example microcephaly and mental retardation. Drugs which are used in pregnancy and have teratogenic effects include thalidomide, anticonvulsants such as phenytoin and valproic acid also leads to neural tube defects, congenital heart defects, craniofacial defects, nail and digital hypoplasia, growth abnormalities, and mental deficiencies. Other drugs include antipsychotic and anti-anxiety drugs, anticoagulants, and antihypertensive drugs such as ACE inhibitors also lead to growth dysfunction, renal dysfunction, oligohydramniols, and fetal death. Cigarette smoking has not been linked to major birth defects, but it has some evidence to cause behavioral disturbances. There is also a role of hormones such as androgens, diethylstilbestrol, oral contraceptives, and cortisones in congenital malformations. Maternal diseases which can cause congenital malformations include phenylketonuria. Environmental chemicals such as mercury and lead can also lead to congenital malformations. In head, there can be enlarged fontanelle, congenital cataracts, extrafold, uh, choanal atresia, ear pits or tags, cleft palate or cleft lip, prominent frenula or tongue tie. In abdomen, there can be omphalocele, umbilical hernia, scaphoid abdomen, diaphragmatic hernia, femoral pulses, aortic coarctation, undescended testes, virilized female, fistulas, hypospadias, imperforate anus, Hirsch, Sprung's disease, posterior urethral valves. There can be congenital hip dysplasia, extra digits, single palmar creases, club foot, congenital navi, hemangiomas. The incidence of cleft lip and cleft palate is about 1 in 600 live births. Cleft lip can be with or without cleft palate. Complications of cleft lip or palate include feeding problems, dental problems, sucking problems, eustachian tube dysfunction, speech problems. Its treatment is usually surgical repair. Prenatal diagnosis include alpha-fetoproteins. Neural tube defects can be detected by measurement of a specific protein of fetal origin called alpha-fetoprotein in maternal blood and in amniotic fluid during pregnancy. Ultrasound can be used to visualize the fetus and detect many abnormalities of fetus. Amniocentesis is possible only in second trimester after the completion of 12 weeks. It can detect many abnormalities, for example, Down syndrome and neural tube defects. Chorionic villi sampling is a new technique that allows prenatal diagnosis at 9 to 11 weeks of pregnancy. By this test, the chromosome status can be easily determined. Prenatal diagnosis of congenital abnormalities offers the parents the option of therapeutic abortion. There are three main approaches to the reduction of congenital abnormalities. Number one is by discouraging further reproduction after the birth of a malformed child. Number two is the avoidance of pregnancy in unfavorable circumstances, such as advanced maternal age and Down syndrome. Number three is the identification and removal of teratogens, such as certain drugs, for example, thalidomide, steroid hormones, folate antagonists, anticonvulsants, infective agents, for example, rubella, cytomegalovirus, herpes simplex virus, varicella zoster virus, and Toxoplasma gondii. Physical agents such as X-rays and irradiation.